Hello and welcome back. Today we're going to be going through the failed airway drill. So this is for a patient who we have RSI'd, and now we're going to try and intubate. So what's the first step? First step is we're obviously going to try and position the patient and try for our direct video laryngoscopy, right? So we're putting something under the head, we're bringing the ear to sternal notch, making sure that the face is flat with the ceiling. Bougie. We're going to go in and we're going to try and tube, making sure that the sats don't drop below 93 at any point, right? I'm going to try, and I can't see anything, right? So I'm unable to intubate, failed intubation, all right? We then come back with our BVM and we ventilate. This is attached to 100% oxygen. We have an OPA in, double CE grip, someone else is bagging. We can now have chest rise, right? If we have chest rise, that's fine, because it means we can oxygenate and we can ventilate. We've been ventilating for a moment, for about 2 to 3 minutes. Sats come up, put that back down. We're then going to try and intubate again, all right? Now we're going to step it up. We're going to go for a video laryngoscopy. We're going to then try and position even more. Maybe we can sit up the patient, whatever the case we need to do. We're then going to try and intubate, right? We're trying, still can't get it in. So another failed attempt, right? The other question that's important to consider is what considers an attempt? An attempt is when the blade goes into the mouth. If the blade goes into the mouth and then the blade comes out the mouth, that is one attempt. So now we've had 2 attempts. Back to the BVM, back with the OPA, back with double CE grip. Do we get chest rise? If we don't get chest rise, it then goes straight for I-gel. So we're getting chest rise, that's fine. We're not in a critical, can't ventilate, can't intubate. We're ventilating. We're now even getting the most experienced in the room to do the 3rd attempt, making sure that we are completely optimized. Everything is in the correct position. Can we then intubate? All right. Still can't intubate, failed. All right. We now have a failed airway, 3 attempts. All right. We're then going to go for our I-gel. We're going to place our I-gel. And we're going to ventilate. Okay, the question now is, do we have good enough chest rise? Is this maintaining saturation? Do we actually have a seal with the I-gel? If the I-gel is not working, we're then going to go for front of neck access, right? So I have a quick track here, nice and easy. Landmark over there, push it straight. I'm not going to push it because this mannequin doesn't do this. I'm going to push it straight in, straight down, detach this, push in that catheter, pull out the needle, put that in the bin, and we can attach our BVM onto that, inflate the cuff, and we have our surgical cross. So 1 attempt, didn't work. Reposition, video, laryngoscopy, lift the head, make sure everything is positioned, go again. If that doesn't work, bring in the most experienced, have your 3rd try. As long as you can get chest rise in between with the BVM, it's fine. We go for 3 maximum attempts. After your 3rd attempt, we go I-gel. If I-gel is not working or doesn't have sufficient seal, or we aren't getting the sats that we need, we then go for front of neck.